Allison. I'm going to be your nurse today. Can you tell me your name and date of birth? Okay, so we're going to be doing a skin assessment, and we're going to change your ostomy bag today and set up a primary IV. So I'm going to put on my gloves after my hand hygiene, which I did, and close the curtain. I don't know if I said that. Okay, so first I'm going to sit you up, and we're going to assess your skin. Or not sit up. Okay, that's fine too. So normally we would change an ostomy bag 2 to 4 hours after a meal or just before a meal. So I'm gonna pull up your gown a little bit so I can check. Okay, so I'm going to assess your skin. I don't see any lesions. The skin texture appears smooth. The color is appropriate for the ethnicity, and no rashes or anything abnormal noted on the skin. So I'm going to assess your skin turgor up here. There's a 3-second return, which could be dehydration, so that's why we're going to be setting up a primary saline. And the temperature of your skin. The skin is warm and dry. Okay, so next we're going to empty this ostomy bag into a clear container. So I'm going to unclamp it. I'm going to save the clamp.
Yeah, I felt like I got a lot more noted actual stuff like this. Saying will help me just feel better about it because I just keep your legs in this position. You're fine.
Okay, so I'm going to assess this, and there is 2 milliliters of watery and green stool. So I'm going to put it out of the patient's sight, and I'm going to document that. And now I'm going to take this off. I'm going to hold the skin down and peel from top to bottom. So I'm going to pull the skin back after taking this off first. Hold on. Take this off. And put it in this red bag, which is accidentally all the way over here. And now I'm going to peel this from top to bottom. Hold the skin down and peel it away. Okay. And now I'm going to assess the stoma. I'm going to change my gloves while I do that. Changing my gloves. These gloves are ripping. Okay. So the stoma appears uniform to the rest of the body. It's round and red. There's no excess drainage. Yes. Okay. So I'm going to cover it with a piece of gauze for now, so that if anything leaks out, it just goes onto the gauze. And I'm going to begin to clean it. This is my water and my washcloth. I'm just gonna clean it out. Take this off. I'm gonna clean any excess stool, any other drainages that there might be. And then I'm going to dry it with a paper towel. This is my paper towel. Drying it. Okay. So now I'm going to cut out a new wafer, and I'm going to measure it on the stoma. So that is the 1.5. I'm going to cut this to that. And you want to make sure when you cut it that the edges are smooth and even so that it can sit flush on the skin, and so that there's no drainage leaking out of the bag and on the skin, which would make the skin irritated, which we do not want. Okay. So I'm going to smooth out those edges now. new bag. I'm going to first go and tape this down. You would normally use the white adhesive, but since we can't do that, we're just going to tape it. You doing okay? Okay. Almost done with this part. Put down. And then it's a two-step, so I'm going to attach this on top. And then I'm going to attach my clip. And just fold it up. And just clip it on there. And then I'm going to cover them back up. Okay, so now I'm going to change my gloves and we're going to begin the primary solution. So, okay, no, okay, just keep it. Okay, patient education. I would talk. Okay, bye, Kendall. Kendall's leaving. I'm gonna come over here so I can be a little. Okay, I have my supplies for the saline administration. I feel like I'm forgetting a step, but I don't know. No, I definitely am not. I'm good. Oh, okay, everything's fine. Okay, so this is my saline bag that we're going to be using for you today because of your dehydration. So yeah, I just changed my clothes. Okay, here's what patient education, and we need to talk about the mechanism of action, which is, this is a primary saline sodium chloride solution, 0.9%, normal saline. Side effects include, since it's an isotonic solution, it stays in the vascular system. Renal failure can occur, fluid overload, edema. So the nursing interventions could be listening to the lungs for any crackles, and then checking for edema and checking blood pressure. And then the 10 patient rights. The 10 rights for administering medication is the right patient, right time, right dose, right route, right medication, right documentation, right assessment, right patient education, right evaluation, and the right to refuse. So next I'm going to check my check in the chart and make sure I have the right solution. So I'm checking in the chart, and then I'm checking the label, and then I'm going to check in the chart, and I'm going to check your wristband, and then I'm going to scan this, and then I'm going to scan the wristband, scan, and then I'm going to check one more time the right route in the chart. Okay, now I'm going to get my tubing. We're going to begin to prime my tubing. So here we have it. Okay, first I'm going to take out this cap and this red cap, and this has water in it from somebody else. Okay, this is the spike, and you put it right in there like so. And then I'm going to hang it up because I don't have enough hang. Oh, and make sure it's closed. Make sure the rolling clamp is closed, which it is. That's good. Okay. And then you're going to squeeze this until it's halfway full, which it is. And now I'm going to prime it. I'm going to get this trash can right here. And I'm going to slowly release until I see a little drip. Ooh. Interesting. Okay. Well, there it goes. Okay. Okay. Oh, okay. Yeah, it's working. It's definitely working. Okay. I'm going to keep that on there. I'm going to close my clamp again. And I'm going to come over to my patient. just gonna put this tubing here. I'm going to take a alcohol wipe and wipe this like 15 times. That's what I was just told. So the IV box is clean. I would check the IV and make sure there's no irritation around this site, and check for what is it called? Infiltration. Yes, that's it. Okay. Which there is none, so we're good to go. And then I'm going to. Oh wait, I forgot an important step. That is putting this in here. Okay. So what you do is put the blue part on the other blue part, and you stretch that up, and you put it in there. Okay. Great. All right. Now I'm going to attach this to my patient. Okay. Okay, now I'm going to turn the pump on. System on. Okay. Okay, it wants to be quiet. Confirm. New patient, yes. New patient. A, B, C. Confirm. And then we're going to be using channel B. And we're going to do a basic infusion. And the chart said 25 milliliters. 25 milliliters. Oh, don't wait. No, let me do this. Please. Okay, 25, and then it's 1,000 milliliter bag. And then start. Ta-da! Okay, so then you just wait for the drip to come through the chamber, but it's going to be slow. 25 milliliters an hour is not a lot. Okay, ooh, channel select. Hello. It doesn't like. Please. Okay, there it goes. Okay, so then I would check and see how my patient tolerated the procedure. Are you doing okay? Good. Okay, and I would check for any nausea. This thing doesn't like me. There it goes. Okay. No. Alarm. Why? Patient side. Why do you not like? Oh, it's because my clamp is closed. Open the clamp. Okay. All right. Let's pretend it's working. Okay, now it's working. Okay, so I would check and see if they're feeling nauseous, and see if they're in any pain, and I could check for edema, do any of my nursing interventions, which were listen to lung sounds, check for edema, check blood pressure. Now it's working. I feel much better. Okay. Yeah, I think that's it. Do you need anything else from me? No? Okay, I would lower the bed to the ground and make sure that they're comfortable. Okay.